Pondicherry University Women Health Awareness Program. Today, we are dedicating this space to focus on the crucial topic women health. As a woman, we handle multiple roles like students, daughters, partners, mothers, friends, and so on. And in between all these, prioritizing our own well being can often fall short. By taking charge of your health, empowers you to live a fulfilling and the vibrant life, both inside and outside the university walls. This program offers a platform for open discussion, exploration of critical health topics, and most importantly, knowledge and empowerment. We have a fantastic two speakers who are experts in this field, and they will be sharing their insights on a variety of health issues related to the women. We encourage you to actively participate, ask questions, and connect with these speakers. As your health is the lifelong investment, and by equipping yourself with the right knowledge and the resources, you are taking a giant leap towards the healthier, happier, and the successful student life for an empowered future. Now, to get things started, we are honored to have Dr. CVPS. Dr. CVPS is Assistant Dean, Students Welfare Program of Pondicherry University. She is currently an Associate Professor in the Department of Tourism Study in the Pondicherry University. So, to set the tone for today's event and sharing some warm welcome words, I would like to request Dr. CVPS to deliver the welcome address.
A warm good morning to all of you, Honorable Vice Chancellor, Professor Tharani Karasu, our guest speakers, Professor Leda Chadurvedula, Professor D.C. Madangi, Professor P. Tilagan, Dean Academics, Professor Hannah R. Vasanthi, the coordinator of this event, our faculty members, Dr. Regina, and other faculty members, scholars, students, and staff of Pondicherry University. This Women Health Awareness Program, which we are organizing today, is a very special and satisfying event for the Office of the Dean Students Welfare. This actually we have planned especially for the women community, to begin with the scholars and students of Pondicherry University. So we have planned to extend this program for the faculty and staff also. As all of you know, women play a vital role in a family, in her workspace, or community as a whole. So the basic nature of women, that is everybody we know that, it is to take care of people around her. So we take care of everybody around us. While fulfilling our responsibility in different roles, we have seen majority of women ignoring her health. Maybe she's ignoring or she don't find time for herself. So the reality is, if there is healthy women, they are better able to take care of their families, including their children, elderly parents, in-laws, and other dependents, and through her, the community also thrive. The foremost thing what we should understand is, women's health is very essential for herself and also for the future generation. So this awareness, when to start this awareness about our health? Awareness about the importance of our physical and mental health should reach us as early as possible so that we can help ourselves to be healthy. So as teachers, we have seen many of our female students and scholars facing lots of physical and mental issues, and we have that concern always for them, and that is the reason why we have organized this program for you. So we received wonderful support from our administration for a good cause, and that is how we could able to organize this program. So let me now go to my responsibility of welcoming our resource persons, guests, and all of you have assembled here. First of all, let me welcome our Honorable Vice Chancellor, Professor K. Tharani Karasu. Sir is always encouraging us to organize events for the well-being of our students. We have already started counseling services for our students. under Sir's guidance. We have already started. You may be knowing a panel of counselors, psychiatrists and psychologists. We have already shared through the department, and it's already posted in the university website also. Students also are in need of such services, we can make use of it. So Sir is always there for such assistance for our students, and we are doing it under his guidance. Sir, I wholeheartedly welcome you to this function, which is mainly meant for women's health. Now let me welcome Professor P. Thilagan, the Dean Academics. I came to know from Professor Hannah that Sir actually conceived this idea and suggested her to organize some health awareness program for our girls in the campus. So Sir, we are grateful to you for this initiative, and I welcome you to this event. We are fortunate to get two experts, two doctors, to discuss about women health and the power of women. First of all, let me welcome Professor Leda Chadurvedula, former head of the Department of Obstetrics and Gynecology, JIPMER Pondicherry. I'm happy to inform that she was our alumnus also. When JIPMER was affiliated to Pondicherry University, she was the first batch of student, and thus she's associated with our university too. And she has more than 30 years of experience in this field, and she is now President of Obstetrics and Gynecology Society of Pondicherry. So on behalf of Pondicherry University, I welcome you, ma'am. Next, it's my great honor to welcome Dr. D. Madanki, who established a new department and academic program, Mind, Body, Medicine and Lifestyle. It's very interesting to know about this program, ma'am. She has done research in the area of stress and sleep, which is very, very important for all of us. And she has completed many projects in that area. And she is recipient of many prestigious awards in her scientific deliberations. And she's a certified life coach and conducts programs for professionals on mental, emotional well-being and stress management. Ma'am, I welcome you to this session and look forward to hear from you. Now let me welcome Dr. Hannah R. Vasanthi, professor and former head of biotechnology, who actually did a wonderful effort to make this event happen. I appreciate her concern concern for the society, and especially concern for our students' health. I welcome you, ma'am, to this event, and my appreciation to her for taking up this project. Now let me welcome our faculty members. Our Chief Warden has also arrived, Chief Warden, Deputy Chief Warden, and the students and scholars who have positively responded to our invitation and joined for this program. I'm sure this session will be a great eye-opener for all of us. I also welcome our team of EMRC. They're always with us to record our programs and help us whatever required. And we have our office staff of Students' Welfare, Hostel, and Electric Department. I welcome all of you. Once again, I welcome each one of you present here to this Women Health Awareness Program. Have a wonderful day, have a wonderful and resourceful day. Thank you.
Thank you, ma'am. Now, to give you the clear picture of what to expect today, we will have an overview of today's session from Professor Hannah R. Vasanthi, who is currently the professor in the Department of Biotechnology, Pondicherry University. She was the expert member of several committee and student-friendly programs and the associations. She was also the former HOD of Department of Biotechnology. She will be guiding us through the lineup of events and the activities which have been planned for the day. So I request Professor Hannah R. Vasanthi to the podium to give overview of the program.
So my job, good morning one and all, my job has been simplified by Dr. Sibi. She has already given an overview, but then I thought how it was evolved, so that everyone will know really what is so important to conduct this program. So it really gives me an immense pleasure, and I stand before you to give an overview of this program for our young women, students and research scholars. Increasing the gross enrollment ratio is one of the key aims of India's new educational policy. According to the All India Survey on Higher Education, the number of Indian women enrolled for higher education is more in 2019-20 and is projected to increase in the next decade. Interestingly, nearly 50% of the total enrollment in 2019-20, according to the All India survey, consists of female students. And the rise in female enrollment in higher education during this period is almost 20%, which is more than the male counterparts. A similar trend has followed in Pondicherry University in recent times, and further female candidates excel at the PhD level also. If you see the recent CBSE results, the 10th, 12th results, everywhere it is the female are standing first. So they all come into the higher education pool. However, young women in higher education face a lot of problems in the place of study and work due to several issues. This leads to several health problems among girl students, such as malnourishment and vitamin deficiencies, leading to infections and anemia, stress leading to psychological problems, and hormonal imbalances leading to a lot of gynecological issues. This is more prevalent among hostel inmates. Empowerment of women through knowledge, skills, and good health will project the growth of our country in several dimensions. Therefore, the need of the hour is to build an integrated, resilient health system for women stakeholders of Pondicherry University. Keeping this in mind, several initiatives have been taken up as a university for building up an integrated health system to empower all women stakeholders of the campus. As part of the Women's Day celebration, many debates, competitions, talks, and health camps were arranged on campus. Subsequently, as an initiative of attaining the Sustainable Development Goals charted by the United Nations, specifically the SDG 3, Good Health and Well-being, series of activities were planned for all women stakeholders on campus. As part of the World Health Day, which is celebrated on 7th April all over the world, commemorating the inception of WHO, specific health concern each year is focused. The theme of this year is My Health, My Right, which resonates profoundly, emphasizing the fundamental principle that health is a basic human right. This theme underscores the urgent need through health disparities, ensure equitable access to health care, and empower individuals to take care of their well-being, and make our young women empowered for self-reliance. The very idea of specifically supporting and helping the female students to overcome the health issues they are facing and the future complications they will face if not attended was brought out by Professor Thilagan, our Dean Academics, and our Vice Chancellor, Professor Tarnikarsu. They felt that students can excel in their academics and research if they have good, healthy body and a sound mind. To start with, an awareness program with interactive sessions for student and research scholars was proposed by the Department of Biotechnology and the Student Welfare Wing of Pondicherry University as part of celebrating the World Health Day. Professor Venkat Rao, our Dean Student Welfare, was so enthusiastic in helping me in coordinating the entire program as it involved the welfare of all our students. Accordingly, a convenient date was decided and two eminent experts on women health and well-being from prestigious medical colleges and research institutes in South India are invited to highlight the common problems faced by women in their reproductive age and their consequences if not addressed, and explain remedial measures to overcome the same by simple tips and medical advices. Dr. Latwa Chaturvedula is a patient-centric doctor at JIPMER with expertise in oncology, infertility, and high-risk obstetrics. Dr. Madangi, a good friend of mine from Ramchandra Medical College, is an expert in sleep and stress management. As a certified adolescent coach and her interest in influencing young minds, she is an expert in personality development and lifestyle modifications. The target group of this program is our female postgraduate students and research scholars. The program will highlight on understanding the basis of womanhood, nutrition, mind, and lifestyle for healthy well-being, healthy relationships and body image, and some common medical problems related to women of reproductive age. You are welcome to interact with our doctors and be benefited. I hope this program would enlighten our beautiful young women aware of some medical complexities pertaining to women's health. Understanding the same and taking remedial measures would ensure integrated and resilient health systems for women in higher education, a key for developed India. Thank you.
Thank you, ma'am. As Professor Hannah R. Vasanti has mentioned, the brain behind this program is Professor P. Tilakan, our Dean Academics, who is currently a professor in Center of Green Energy Technology in Pondicherry University. So I request Professor P. Tilakan to felicitate the gathering.
I hope you understand the motivation of this program now very well. So it was our duty to have health awareness programs to be established. When I was discussing with our Vice Chancellor, he was immediately agreed, and then he said to go ahead. So, health is our wealth. So we have to understand who we are, and then how we have to maintain ourselves to get good health, and then everything comes next. So by thinking this program is organized, and then Professor Hannah Rachel Vasanti took lot of effort to organize this program. I hope this program will be very much useful for all of you. Please make use of it, and then spread to your classmates or your friends about this program. I wish you all the best, and then get all benefit whichever is possible. Thank you very much.
Thank you so much, sir. As any program without the inaugural address is not complete, so we are privileged to have our Honorable Vice Chancellor, Professor K. Taranikaru, to inaugurate and share some insightful words.
Good morning, everyone. I think all are not very enthusiastic about this. Say good morning. Good morning. Yes, this is the voice we require from you. Because unless otherwise you are very enthusiastic, we feel also depressed. So we are arranging, but students are not interested. Frankly speaking, I am not happy with the number of students also. We have more than 8,500 students totally, and the hall capacity is 400. So it should be full now, because that is the importance of this program. Anyway, we are doing our duty. Respected Dean, Professor Tilakan, Dean Academics, Professor Tilakan, and Dr. Sibi, Assistant Dean, Student Welfare, Professor Hannah R. Vasanti, Department of Biotechnology, who is the coordinator for this, and Professor Lata Chaturvedula, Department of O&G, JIPMER, Puducherry, and Professor D.C. Madanki from SRI HER, and all the faculty members, Chief Warden, as well as the Deputy Chief Warden, all the students who are assembled here. Good morning, everyone. So, this program is mainly, it is a part of the Dean Student Welfare, that is Student Welfare activity. When it comes to the student welfare, mental health, the Ministry of Education also taking it very seriously. They are having series of discussion with all vice chancellors. So we recently had one meeting, such meeting with our Secretary of Ministry of Education. So he also quoted this. They are planning more and more preventive measures like the mental health as well as the health of the students, how to build a good nation. So once the health problem comes, how to cure, that is secondary. But before this, how to give the knowledge to the students so that they know the problems, whatever they have, how to handle this. So Ministry is also taking various measures. In our university, we are through Dean Student Welfare, we are doing so many preventive measures also. And in this angle, we have recently formed a panel of the psychologists and it is earlier whatever the students have the issues, whether it is health or the psychological issues, they will only consult our doctors inside, or they will go to PIMS or on their own. But now we have a panel of the experts. It is available in the internet on the Dean Student Welfare page. There, what we have planned is you can directly contact the doctors, because since it is the personal to the students, we have planned in such a way that you need not inform to even any of the teachers inside. You can directly contact the in the panel. You can choose whoever you want. You can fix the appointment with them, and they will either come to the university. That time you can meet and tell your psychological issues, or you can, if it is very urgent, you can fix appointment. They can go there also. There, whatever the hospital they have, you can visit there, and whatever the payment, the university will take care. You need not pay to this. We have fixed the panel members in the subsidized price also. So this is what we have done it, and wherever I go regarding this, I used to tell the students also, because many students do not know about this. This is a free service. Whenever you have any issues, you can directly contact the particular doctor. You can freely, even you may not know. The big problem for the psychological issue is they don't want to don't want to reveal to anyone. So the important thing we have to understand is, don't own your problems. The problems are there. It is, if you go back, you go and then tell that this is the problem I have. So you may be thinking that it is only applicable to only you and it's not to others. If you go and discuss with the experts only, they say this is normal. This is everyone has this. Only the psychology experts only know what type of problem you have, how to handle this. Once you discuss with the psychologist, then you will understand what type of problem you have. And you discuss with only your friends or relatives, then they are not a counselors basically. They will aggravate the issues. They will try to put that you are the problem, you only created it. Like this, they will put the blame on you. But it is not, nothing is, personal here. All are scientific. Whether you have a psychological issues or health issues, all are scientific. So we should not feel, depressed, or should not feel guilty also for anything. That is the first thing as an educated girl you have to have. You should be brave. The braveness comes for the clarity. For this, you should know that these are all normal. So don't feel guilty to tell your problems with the doctors and come out of this. That is the first decision you have to take. Without this, no doctors, no awareness program will help you. So that is the first thing I thought I will share. We have a panel of examiners, a panel of the psychologists who can be there, and the university now also going for we have a PIMS doctors now inside our campus. We are going to appoint new doctors also, and with existing doctors have retired, we are going to appoint new doctors. So you can go and tell them. So we have these type of common problems. If fix the some of the doctors, they will visit a particular time on a weekly basis, once and twice. We are ready to do this also. So that is what I thought I will discuss with the doctors, our university doctors, and fix also whether for example, eye camp. So periodically one eye specialist will come on weekly basis, 1 hour, 2 hours per day, per week. And similarly, the cardiologists, they can come here weekly once. So you can discuss those problems. So in this angle only we are organizing this, and student welfare, they are taking it very positive, and they are arranging many programs. This is one of this program, and I saw that Professor Lata Chaturvedula is from JIPMER. I came to know that Madam is our alumni. She studied here when JIPMER was affiliated to us. JIPMER was affiliated to us from 1986 to 2008. That's what I know it was affiliated to us, but exact year I came to know from her only because she was from JIPMER. And I thank Professor Lata Chaturvedula for allotting time for us, because the OG doctor means they call it as, I generally consider they are mother of mothers. So they take care of all mother problem, and for kids also, that it is very difficult to handle the newborn babies. So they know this, how difficult to handle this. So this is very useful field for the for our society. She may be always, I see these doctors, they proud. I saw this many deliveries, and we created this much, take care of this much babies. They always, generally we as the PhD supervisor, we always say this many students completed in my career, this many project I completed like this. The doctors maybe they are thinking this many deliveries I have seen. So this is a pride moment everyone will think. So in this, I thank Madam for, there is no need, whenever we invite, there is no need to come, definitely. But so the JIPMER doctors always very busy. So they have taken the time to come here and discuss with the problems. See, you see the title, issues related to women health in reproductive age, do's and don'ts. So this is very important for at this age, because I always tell also, in our society, we don't, whenever the marriage, planned, all the arrangements for marriage, everything is done for the outside, how they feel about us. For our pride, we do it. But when it comes to the bride and bridegroom, we don't teach them how to deal a life. There is the government also no organizes, and parents also, their advice also, it will be it will not be really useful. So, in this, how to lead a life psychologically, what are the problem will come, and then the health wise, what are the problem will come. No organization we have, but in many countries they have this organization. Before they get marriage, they have to attend this government program and get the certificate from them. Then only they are ready for the marriage. But unfortunately, we don't have in our country. So anybody can marry or anybody can divorce, like this it is going on. This is not good for the society, I am telling, because by affecting our life, after this, whatever the lesson we learn, it is of no use. Already we lost our life. So this is only curing. We have many curing techniques, but we don't have the preventive techniques. So we don't have any organization who are teaching us what are the problems, health problems as well as psychological problems you will get after marriage. So these type of things, this title will definitely help you. So what are the issues related to human health? So in the reproductive age, this is one thing. This will be useful for the body. Then second session is about the mind, body, medicine and lifestyle. This is about our mind. If you can able to control your mind, then you can able to control some of the disease also, whatever the disease is come. This is rarely you will understand. So in these two also, mind and body, there is a third one which is called soul. If you can control the soul, the mind can also be controlled, health can also be controlled. That will the only spiritual leaders will tell us. Today we will take care only mind as well as body. So these two titles, I think Professor Anna Vasanthi has selected this. I thank her for organizing this, and I thank both the experts today who are taking time to come and deliver the lecture. Thank you, one and all.
Thank you, sir, for your inspirational and insightful words. Now I request our Vice Chancellor, Professor Tarini Karsu, to felicitate our guest speaker, Professor Lata Chaturvedula, with a memento as a token of our love and appreciation.